Ya't e Tammy Trujillo Yinishya. Hello everyone, my name is Tammy Trujillo, and you should all know that by now because we took this class together over the summer. But that's besides the point. I'm going to be focusing my presentation on mental health among Native communities in the U.S. I wanted to focus on Native community as a whole because I didn't just want to narrow it down to my tribe, the Navajo. I wanted to get a better idea as what issues are revolving around mental health in our communities. Beginning with policy, I believe the policy around mental health isn't as strong as it should be. This type of issue should be addressed, and the reason why attention isn't given to mental health as much as it should is because it's creating this disconnection from our culture, especially in regards to cultural values and traditions. In doing so, there could be an input of these values, so it creates a much more comfortable atmosphere for Native people, whether it's dealing with family or domestic violence or drug and alcohol abuse. There should be much more prevention programs as well as facilities to help create this atmosphere for our Native communities. And although there are professionals and mental health facilities through the Indian Health Services, there is always much more that can be done in making mental health a much more comfortable topic to talk about among our Native communities. Going into specifics, not only are tribes dealing with drug and alcohol abuse, the next issue is suicide. And suicide is crippling our Native communities because it's causing our communities to suffer in a way that this topic should be addressed. And according to the Centers for Disease Control, Native Americans have the highest suicide rates compared to the U.S. population. This is the 8th leading cause of death for American Indian and Alaska Native of all ages, and more so among our youth. It is the 2nd leading cause of death among youth ages 10 to 24. So, in regards to suicide, mental health can help treat these patients as well as decrease these suicidal rates. Unfortunately, the tribe that has the highest rate of suicide is the Menominee tribe. It is the highest among their Native youth, and it causes 30 deaths per 100,000 people, which is 2 times higher than the national rate for Native Americans. So mental health should be given attention because it can prevent as well as decrease these rates among our Native communities. Thank you for watching.